How do plastic surgeons use muscle anatomy in a brow lift? Have you ever wondered how plastic surgeons achieve that youthful brow lift look? Understanding the muscle anatomy of the forehead and brow region is crucial for this procedure. The primary aim is to elevate the eyebrows and reduce forehead wrinkles by carefully manipulating the muscles that control brow movement. One of the key players in this process is the frontalis muscle. This muscle is the major elevator of the brow. It starts from a tough fibrous layer on the scalp and attaches to the skin of the lower forehead and brow. When the frontalis muscle contracts, it raises the eyebrows and smooths out the forehead. During surgery, plastic surgeons often adjust this muscle to achieve the desired elevation of the brow. Another important muscle is the Orbicularis oculi. This circular muscle surrounds the eye and acts as a brow depressor, pulling the brows downward. Surgeons carefully releases or weaken parts of this muscle to lessen its downward pull, allowing the brow to lift more easily. The corrugator supercilii and Procerus muscles are smaller muscles located between the eyebrows. They contribute to frown lines by pulling the brows downward and inward. To improve brow position and reduce frown lines, surgeons may weaken or partially remove these muscles. However, it is important to note that complete removal can affect the shape of the brow. During a brow lift, surgeons create incisions, often hidden within the hairline, and dissect beneath the skin to access these muscles and underlying tissues. They may release or weaken the depressor muscles to reduce the downward forces on the brow. Additionally, they elevate and reposition the frontalis muscle and the overlying soft tissues. Sometimes, they lift the temporoparietal fascia and temporal muscles to achieve the desired brow height. To ensure the new brow position is maintained, surgeons anchor the lifted tissues to the underlying bone using sutures, screws, or fixation devices. In endoscopic brow lifts, small incisions and an endoscope are used to visualize and manipulate these muscles and soft tissues, resulting in minimal scarring. Understanding the interplay of these muscles allows plastic surgeons to tailor the procedure to each patient's unique anatomy and aesthetic goals. This ensures that the brow is lifted effectively while maintaining a natural expression and function. In summary, plastic surgeons utilize muscle anatomy in a brow lift by targeting the frontalis muscle to elevate the brow, modifying the orbicularis oculi, corrugator, and Procerus muscles to reduce downward pull and frown lines, releasing and repositioning muscle and soft tissue layers, and securing the lifted tissues to the skull to maintain results. This muscle-focused approach is fundamental to correcting brow ptosis and addressing signs of aging in the forehead, providing both functional and aesthetic benefits. Always remember to consult with a healthcare professional for personalized advice regarding any surgical procedure.